Hello, I'm Andrew Halloran. I'm the Director of Chimpanzee Behavior and Care here at Save the Chimps. Save the Chimps is one of the largest chimpanzee sanctuaries in the world. In fact, we are the largest privately funded chimpanzee sanctuary in the world. We're located in Fort Pierce, Florida, and we're home to 227 chimpanzees. And what our mission is to provide sanctuary for chimpanzees in need. And what that means is we have chimpanzees from a whole host of backgrounds. Most of our chimpanzees come from biomedical research. However, we also have a large portion of our chimpanzees that used to be pets. We have some chimpanzees that were used in entertainment. And because of this, even within those categories, each chimpanzee has a very unique background and very unique challenges to what we would consider thriving for a chimpanzee. So our mission is to provide sanctuary. However, it's really critical for us to define what that means. What is sanctuary for a chimpanzee? And to us, what sanctuary is, it's not just a home for chimpanzees, it's not just space for chimpanzees to be in, but it's a place where chimpanzees can actually thrive as chimpanzees. And what is thriving for a chimpanzee? Well, chimpanzees require a rich social environment. At Save the Chimps, they live in social groups up to 23 other individuals with them. Chimpanzees also require freedom of choice and self-determination in order to thrive. And so at Save the Chimps, we have a situation where chimpanzees are free to roam their habitats that are up to 5 acres large. They can sleep inside, they can sleep outside. There's never a time they need to be on exhibit or anything like that. The only time we kind of keep them in one place is when obviously we're cleaning any of their habitat. Chimpanzees also require a cognitively stimulating environment, or an environment that they can engage with in a way that allows them to realize kind of that natural curiosity that chimpanzees have. And also an enriching environment. So at Save the Chimps, we provide 3 different enrichments per day for each individual. These enrichments are designed to stimulate them socially, to promote movement, to stimulate them cognitively, and they're carefully planned out. Now, what I really wanted to talk about today is that because we have so many chimpanzees of such diverse backgrounds, what's really key to providing that sanctuary for each chimpanzee is that we provide individualized care for each chimpanzee. And each chimpanzee, due to their background, has unique challenges to thriving, unique barriers to thriving. So a chimpanzee may have lived their entire life isolated from other chimpanzees. That would prevent a barrier to having that rich social environment. Maybe chimpanzees have been through various aspects of trauma, which gives them another type of barrier to thriving. So what's really critical for us to do is to determine what those individual needs are, and even after we make that determination, to keep assessing chimpanzees' well-being to make sure that they're continually thriving in our environment. So in order to assess how each chimpanzee is doing, and to further our commitment towards evidence-based care, which is really foundational to our care goals here, is that every chimpanzee at Save the Chimps every year gets a 60-day assessment period for general well-being, for general welfare. And during that time, our behavior and care staff will observe the chimpanzees for certain indicators and score those indicators based on how that chimpanzee is is doing, how they're behaving, different key indicators that they may be looking for. At the same time, we also observe chimpanzees in their social environment, further away, not when they're inside and not when they're interacting with staff. And we do basic ethograms within basic ethology with those chimpanzees using kind of a basic ethogram. From this, we can score other behaviors. We also, during that time, can arrive at grooming charts to see who's grooming with who. It also lets us know kind of how social that chimpanzee is doing. We look at proximity charts to see who's basically sitting closer to who and who's sitting far away. And all of these things allow us to establish a general baseline for each individual. Now, just because it's baseline doesn't mean it's positive or negative, but it allows us to know kind of what the norm for that individual is. And then what we can do is, if there are any changes to that baseline during their assessment period, we can look at what external factors might be affecting that or internal factors might be affecting that, and we can mitigate that through various care plans that we have. I'm going to give 3 different examples. The first is a chimpanzee named Whoopi. Whoopi is a chimpanzee that likely very early in life dealt with food deprivation. And as a result, we see Whoopi having frequent bouts of anxiety when food is present, when another chimpanzee is being fed, when Whoopi can't get to food. And sometimes these bouts of anxiety lead to some behaviors that really compromise Whoopi's general welfare. Sometimes it leads to self-directed behavior, and sometimes even to self-injurious behavior. So when Whoopi started having more bouts of food anxiety, this started with a staff observation of this, and we triggered a care and welfare assessment for Whoopi. And what Whoopi's care and welfare assessment showed was that she was scoring positively, meaning more of these food anxiety behaviors, and we were able to record what kind of external factor was going on when these bouts of anxiety would happen. In Whoopi's case, this was triggered by a change in the dynamics of the population that was going on. And we've been able to since mitigate this by distracting Whoopi with different enrichments and different care plans and different feeding plans. And as a result, Whoopi has gone from showing positive or more food anxiety behaviors to returning to her baseline, and then even showing negative, that she has much less even than her baseline food anxiety behaviors. So we've been able to see this approach have some great effects for Whoopi. Another chimpanzee I'd like to talk about is a chimpanzee named Butch. Butch was scoring on his care and welfare indicator positive or more behaviors for aggression. He was also getting wounded more. So with that, we were looking at external factors that could be leading to this. One of the things that we saw when we were doing these observations is that during times of aggression, the chimpanzees on Butch's Island were basically outside. They were all congregating in one area. And because of that, Butch would retreat inside. And because he was inside, he would become sort of the target of aggression during these big aggressive happenings at his island. So what we were able to do with that information is that we constructed new shade structures on the island and new permanent enrichment devices on the island, large land feeders and things like that. This allowed the group to disperse more, and as a result, Butch is less prone to retreating inside because these aggressive encounters aren't all happening in one place, and Butch will actually then run out onto the island during any sort of conflict. And because of that, we've actually seen Butch return to his baseline, and we've seen the injuries all but disappear. And so that's been another positive aspect. Now, a current welfare issue we're looking at is a chimpanzee named Spencer. So Spencer, years ago, was diagnosed with complex PTSD by a psychologist. And I have no reason to doubt that diagnosis because Spencer shows what you would see with anyone with complex PTSD. He gets very hyper-focused on things that are happening outside of his environment, things that are kind of outside of his control circle. In this case, we had staff turnover during COVID. And so there was a lot of new care technicians opening and closing doors. There was new care technicians feeding him. A lot of things that were happening outside of Spencer's world that were causing him pretty extreme bouts of anxiety. And this was definitely compromising his welfare. Spencer was no longer engaging with enrichment. Spencer was not engaging socially with other chimpanzees. He was just focused on these new staff members and unable to thrive in this environment. So given that, what we've been doing is working on a way to give Spencer some more positive interactions with care technicians that allow Spencer some more control in that, and in this case, operant conditioning. So we've been doing station training and target training with Spencer during times that doors might be closed for cleaning or food is being offered and things like that. That's shown really great results for him. And as a result, we're seeing that start to decline. Of course, that's in progress, and we'll keep you posted on how that's going. But in any case, there's just a little bit about what we do here at Save the Chimps. You can learn more about us on our website, www.savethechimps.org, and thank you for listening.